Hello, I'm Julia Resnick from the American Hospital Association. In July 2020, AHA's The Value Initiative partnered with the Advancement League to host a virtual event for emerging health leaders, where we discussed how to create a more equitable path forward from the COVID-19 pandemic. In this video, you'll be hearing from Monica Ramirez, founder of Justice for Migrant Women. She and AHA's Priya Bathija talk about the impact of COVID-19 on farm workers and what we can do to protect farm workers during the pandemic.
Monica, I'd love to have you join me on the screen. I'm so lucky to have met Monica in law school at The Ohio State University. And I won't share how many years ago that was, but we have been friends for a really long time. And in all of the time I've known Moni, she has been an activist and a leader, and she's continually been the person that gives those people who don't have voices a voice. She spent her career fighting for the civil and human rights of women and children across the country, including domestic and farm workers. Monica also sparked the Time's Up movement, which has created a remarkable shift in culture and really changed the course of history for all of us. Moni, we're so happy that you're joining us today. And I'll start with a few questions. And as we're having our conversation, if those in the audience think of some questions to ask, Moni, please type them in the chat and we'll get to them if we have time. So Moni, can you start by sharing a little bit about yourself and your journey and how you got to what you're doing today?
Great. Well, thank you for having me. It's really an honor to be with all of you. I don't normally get to speak to this audience, so I really appreciate the opportunity. And I also appreciate that you didn't say how long ago we met. I come from a migrant farm worker family. And so for those of you who are tuning in who maybe are unfamiliar with the farm worker community, there are 2 to 3 million farm workers in our country who pick, pack, and plant the food that we eat. And my family, both my mother's side of the family and my father's side of the family, used to migrate around the country picking crops and eventually settled out in Ohio, where I live today. And my parents felt really strongly when we were growing up that it was important for us to know our background, our history, and to be proud of our history, not just being Latinx in the United States, but being from a farm worker family. So my work is rooted in the history of my family. And really, I think my work over the years has just been a continuing tribute to my family and the sacrifice that my family has made in many ways, in addition to feeding this nation. But the other thing is, and Priya, you know, because when I was in law school, I made the decision to create the first legal project in the United States specifically focused on the rights of migrant women, and in particular addressing sexual violence against migrant women, which is a major problem. And I made the decision to create that project because it's a very personal project for me. In addition to coming from a farm worker family, unfortunately, a number of women in my family are survivors of sexual violence, and myself am a survivor of sexual violence. So the project that I created in Florida when I started my career was really focused on addressing the needs of women workers, farm worker women workers, who are often overlooked because they're not the majority of the workforce. And I've just been really fortunate that I've been able to continue that work now, for almost 2 decades. And the issues, unfortunately, a lot of them remain the same. A lot of the disparities that exist for farm workers that exist in my family work still exist today. And those are the things that we're continuously trying to address, and that's why we need partnerships like these to be able to try to get to the heart of the problems that exist for farm workers in this country.
Right. And when you talk about farm workers and domestic workers, since we are spending time today talking about the impact of COVID-19, how has that impacted those communities, and how has it made their position so much more dangerous than it was before?
Yeah, well, so domestic workers and farm workers have continued to work throughout the pandemic. Farm workers were deemed essential workers by the federal government, which meant that they would continue to go to work. And domestic workers, though not deemed essential workers by the federal government, have continued to do their work to allow other people to work. And I think that, though a little bit different in the way that COVID is impacting both groups, there are similarities in that domestic workers are faced with isolation. They're often faced with low pay. Many domestic workers in our nation are women of color. Many of them are immigrants, and they've had, many of them are mothers. And so, like farm workers, they've had to make the decision about whether to keep going to work and have income to take home to their families, or stop working and not have income. And some of them, unfortunately, were just automatically dismissed by families that they worked for because people were afraid of the physical distancing. But unfortunately, people didn't continue to pay the domestic workers that they've hired, some of them for years and years, who've been working in their homes. So that's similar because farm workers are also faced with isolation. Farm workers also had to make the difficult choice of continuing to work even without having the protections that they needed. And many farm worker women who I've talked to across the country have talked about the fact that when schools closed down, they had to make the choice as to whether they would take their children with them to work in the fields, or whether they would leave their children home alone, or whether women would just leave the workforce. And I would say that for both groups, we've seen just the acute needs arise around having just food, to be able to feed their families during the crisis, and the inability to access PPE. And in the rural context for farm workers and domestic workers who are working in rural America, and I'm sure that some of you on this, in this chat today are also experiencing this if you're in rural America, that there just weren't enough resources available to continue to do the rural health care and have the clinics open and outreach workers available to be able to reach some of these workers who are among the most isolated. And so we've seen farm workers, we've seen domestic workers, we've seen other low-paid workers who are now contracting COVID at very high rates, and they don't have access to the medical care that they need, and they don't have really very much stability at all in their lives because they can't necessarily rely on their jobs for security. They can't rely on their homes and their home lives for security, and they don't necessarily have the community context that they need in order to support them during this crisis.
Yeah. Well, you mentioned PPE, and as a group of individuals in the healthcare field, I think that's something that all of us can relate to. And I know you and I have had conversations about, PPE generally and how AHA launched our 100 million mask challenge. And while at the same time we were doing that, you were launching masks for farm workers and the COVID pandemic relief fund for farm workers. Can you tell us a little bit about both of those efforts and, how you started them, the need to start them, and really where they are today?
Mm-hmm. Yeah, so we created the Farm Workers Pandemic Relief Fund first. As soon as we realized that this crisis was unraveling, we knew that the farm worker community was going to have a lot of needs and that they likely weren't going to be able to get a lot of support. So together with Hispanics in Philanthropy, which is our fiscal sponsor, we created the fund. We set the first goal for the fund at $3 million, which was representative of $1 per farm worker in this nation, which of course is not enough, but we needed to have a goal to get aid out. And the fund is focused on helping get farm workers food, formula, diapers, emergency cash assistance, and things of that nature. And in the early days of creating the fund, in April, people needed the money for food because they were dealing with food deserts. Everyone was buying everything off the shelves. The workers couldn't get to the store in time because they were working. And now as the crisis has gone on, there's much more need for things like emergency cash assistance to pay rent and utilities and things of that nature. But as we were building that fund, we were approached by a fashion designer named Mario De La Torre, who's a Hollywood fashion designer who usually makes ball gowns, actually, for some of the big fancy events that maybe some of us have watched. He reached out because he wanted to create masks for farm workers because he realized that probably the farm worker community wasn't receiving that kind of aid. And so we started building that project with him and with two other organizations, Hispanic Heritage Foundation and the National Center for Farm Worker Health, and Nicholas Gonzalez, the actor, is our spokesperson. And so Mario and his team have been making masks from their shop in LA. But as the project has evolved, we've been able to count on the support of donors to provide PPE that we are then distributing around the country. So we have about 50 organizations that we're working with around the United States and in Puerto Rico to distribute face masks to farm workers. And we also created a component that was focused on getting masks and other PPE to rural healthcare providers, because we learned that some of the rural healthcare providers, small clinics mainly, were not receiving gloves and masks and other things. So we created sort of a subpart of that project to provide that kind of PPE to those folks.
Yeah. So before I go to my last question, we have a question from Derek Boyd in the chat box that I think ties well with what we've been talking about. And he's asking, what are some of the impacts to health that this population's job loss and unemployment have had? And obviously, I know you mentioned PPE, and if those clinics don't have the PPE, they can't see patients for health conditions. But what are some of the other things you're seeing?
You know, we've been having town halls with farm workers around the country throughout the pandemic to just check in to see what the priorities are. And in the town halls that we've been having, the mental health continues to come up as an issue. People are feeling a lot of anxiety, a lot of stress, either because they have to go to work or because they can't go to work. And we're hearing a lot from parents about their children having high rates of anxiety and mental health consequences because of the pandemic. So those, I want to name that because I think it's really, really important for us to realize that aside from, other physical health consequences, that the mental health, the toll of this crisis on so many of us, including farm workers, has been really high, and we're still trying to figure out how to get community members that kind of care, whether it be counseling through volunteers or other means. The other thing is, I've talked to a number of families, too many families, who talk about how they don't have food for their families. So that is a cruel reality when you're talking about workers who are going to work every day to put food on our tables, and then they don't have enough food for their families. And so people have talked to me about going without food for days, and and getting sick, and their kids getting sick. We've had a couple of people who've reached out to us who are cancer patients who have not been able to continue getting their treatment. One family reached out to us because they didn't have masks, and they weren't going to be able, the father who has cancer wasn't going to be able to continue getting treatment because he didn't have masks. So we've seen, some new health consequences because of COVID, and then we've seen other health issues that are exacerbated because of COVID, either because they can't get the treatment or because, where clinics have closed and they can't see patients. Workers don't have access to the internet, for example, to be able to engage in the online medical diagnosis and treatment that's been happening. Some people have the telecare, and they've been able to access that, but it's been a real challenge to be able to get continuing care during this time. And now we're seeing some new issues crop up because of the stress of the pandemic.
Right. Yeah, and thank you for sharing all of that, because I think a lot of us that don't have a connection to these communities might not realize that all of this is happening right now across the country and impacting really so many farm workers and domestic workers. So I have one last question, and again, welcome others to put questions into the chat box. But since we do have a group of incredibly talented and motivated healthcare leaders here who want to take action and want to improve health equity, what can they do to help?
I think the most important thing that we need partnerships with you. We need to know each other. We need to be figuring out how to do, Dr. Blackstock talked about the holistic care, right? The whole person. And we need to be in partnership because the community that I come from and that we serve is has very specific needs. There are very specific dynamics. And so I think that to the extent that we can create more open communication between the health field and the farm worker advocacy community, that is in the best interest of the community as well as domestic workers. And I also think that we really need, as people are developing plans around COVID response, we need to be at the table. Because, to some listening, you might think, oh, farm workers, that's a very specific population, or domestic workers, that's a very specific population. But our community members are part of the larger community, right? They're part of the larger rural community across across the country. And if farm workers become sick, and as we're seeing rising rates of farm workers contracting COVID, that isn't isolated only to the farm workers themselves. That impacts the rest of the community too. So we want to be at the table when these plans are being made to give input to determine what is going to be workable for the community and what is going to be out of reach. And then certainly, I think that the masks project that you all have created is really important, and I think that to the extent that there can be collaboration there to continue to get masks and other PPE out into the community, that will be important. But I just can't stress enough that partnership is key here. The feedback loop is really important. Figuring out how to use the trusted community leaders and organizations like ours to help be an intermediary. I'm sure many of you have probably heard that a lot of workers right now don't want to be tested. There's a lot of stigma around being tested. Workers don't want to be responsible for getting other people put in quarantine, so they're feeling pressure because they don't want other workers to not have work because they have to get put in quarantine if they get sick. So we really have to work hard together to demystify the testing process, to expand testing to communities like farm workers and domestic workers. And we also really need to work together to address some of the bullying that people are experiencing and some of the stigma related to being tested or becoming sick.
Right. So we have a question from Zeb Purdon, who is from Columbus, Ohio, and went to the Ohio State University as well. But he's saying, he's asking, what impacts have you seen with the rise of digital health for ESL populations, especially with the lack of interpreter integration in telehealth platforms?
And people just don't have access. That's actually one of the things that we've been working on. It's a real problem for healthcare, but it's also a problem for education. So we've been trying to figure out how we can get more hotspots into communities so that the workers will actually have access. And so basically, I think for a lot of people, it's now, a closed line of communication because they don't have access. I know some people who have tried to use the telehealth systems with some success, but, having clinics who are able to take mobile clinics out into the community, that is much more successful, and unfortunately a lot of people are limiting that kind of access because there's no contact care happening because people are trying to limit exposure to COVID. So I would say that on the whole, I think that web-based care is really not working very well for the farm worker community, and I think for others who don't have access. I think in big cities where people have more access to broadband or where there might be more free broadband programs in place, perhaps it's a little easier. But unfortunately, in a lot of places in rural America, people don't have that access.
Right. So another question is coming from Kate Leibelt, who's in Chicago. She's asking, is there a potential intermediary or community health resource that can help bridge the testing divide and help to demystify it?
Yeah, so one of the things that we're looking at is the possibility of having, I don't know if you've heard of the organization CORE. They've been doing testing. That's an organization that was started by Sean Penn, and they've been doing testing in some communities. One of the challenges with the testing, as I'm sure some of you know, is that in some places where they're doing big public testing events, it's being run by the National Guard. And and we're trying to think of ways that we can get testing to people that would not or ways that if the National Guard is going to be involved, that we make it as accessible as possible, because people are really afraid. People are really afraid of the government. Over half of farm workers in our nation are undocumented, and so people are afraid of accessing events like that because they think that maybe they will get turned over to immigration. And so I think that organizations like CORE that are helping to do the testing and working together with other nonprofits like ours and with state governments to do the testing, I think, and even with local health departments, I think that is a good solution. And I think that where local health departments are planning testing events and where they're doing it in collaboration with the National Guard, making sure to ask people to be mindful of how they're dressing and how they're presenting themselves, because if people are afraid that they're going to be picked up by immigration or that there could be some other kind of adverse consequence to being tested, then that's obviously going to limit people's willingness to participate. So we've been talking, for example, here with the state of Ohio about doing testing events at farm worker camps, and the fact that the National Guard has been helping with those testing sites and talking about like what kind of clothes people would wear, what kind of cars people would drive and show up in, those kinds of things, because we don't want it to be intimidating. Otherwise, it will be a barrier for people to get tested.
Right. Yeah, that makes sense. Anton has a really great question, and we only have about 30 seconds left, so I just want to pose it out there, and of course we can continue the dialogue later today. But he's asking if you have any thoughts around the conversation around food waste versus food insecurity, and sort of that conversation that we saw happen early on in the pandemic, where it wasn't a question of whether we had the food, it was getting the food to the right places. Any thoughts there?
Well, I mean, I think, first of all, where dumping has been happening with food, we've been trying to encourage people to donate that food, whether it be to a food bank or to the farm workers themselves. And I also, the other thing is, there is food insecurity happening. It does exist in the farm worker community and with other low-paid people in our country. And I do think that we have to figure out how to make things like food banks accessible to people who are continuing to work throughout the pandemic, because there's been a challenge for people who are continuing to work. They don't then have access to the food that they need because the food banks are not open when they are not working. So those are just two initial thoughts, understanding that we have time limitations. But, I think, and the other reality is, if we don't get things under control with the COVID outbreak among farm workers, we actually could face a food supply issue. So I don't want to downplay that point, because at the beginning of the pandemic, maybe we didn't have a food crisis. But if farm workers, poultry workers, meat packers, and others continue to get sick in large numbers, which we're seeing, it could become a major issue for our food supply chain. And unfortunately, I don't think we have things under control the way that we need to for those populations. And that's a real threat for all of us, in my opinion.
Right. Yeah, thank you, Moni. Thank you so much for being with us today. I feel so lucky that you were here and able to join us and able to really share this perspective that a lot of us don't get on a day-to-day basis.